Facial ligaments. What are they? Why do we have them? Do we need them? And what's done during a deep plane facelift? Lot of confusion around this topic. Let's take it each one. So I think most of the confusion lies in the term ligaments, because when most people think of a ligament, they think of something like your ACL. It stabilizes your knee. It's really important, and if you don't have it, you're in bad shape. That is not what we're talking about when we refer to facial ligaments. So I think the name's a bit of a misnomer. It's an anatomic term. This is given by the anatomist, and it's because of what these structures are. When the face forms, it's extremely complicated, but there are separate structures that form the deeper tissues, the muscles and that mass layer. And then there are different embryonic basis for the skin and the fat pads. And there is no natural connection between those two layers. And so in order to keep things together and in order to allow some blood vessels to grow up in between those planes, your body forms these predictably placed facial ligaments, which are just fibrous thickenings traveling between those deeper layers and the superficial layers. These are not structures that are anatomically necessary. They do not carry any critical blood vessels or nerves. There may be a small blood vessel contained with a ligament, but certainly not something that's critical. The face has excellent blood supply and lots of redundancy. So these ligaments are just there because that's how the face had to form. You don't notice these ligaments until the tissues around them age. As I said, there are no other connections between that superficial fat pad and skin layer and that deeper mass and muscle layer. And so what happens as we age, the superficial layer falls. And because of the position of these ligaments, you get these predictable wrinkles of aging. The nasolabial folds, the marionette lines, the jowls, these are all caused by ligaments that are catching the skin, so the area around it falls and creates these lines. So what does releasing these ligaments involve? It's so interesting because there's so much variation from patient to patient. Some people have short ligaments. Some people have much broader based ligaments, meaning there's a large area of tissue that's firmly adhered to that deeper layer, and sometimes you can even see it as almost a depression in the facial skin in preoperative photos. Other people have very tight ligaments, which they are short and they are dense. They're more difficult to get through. Some people have looser ligaments. In the end, it doesn't really matter. These are all addressed as part of a deep plane facelift, and the ligaments are separated either with fold knife or blunt spreading through and addressing any blood vessels that may pass through them. The beauty of the deep plane lies more in locating and addressing these ligaments fully, which leads to full mobilization of that superficial layer as compared to that deeper layer. So then what becomes your new ligament? How this works is once things are fully mobilized with the deep plane, yes, then we are back to that anatomic basis. There are no natural connections between the superficial and deeper tissues. I reposition that tissue up where it needs to be and then secure it there with these suspension sutures. These are deep sutures. These are buried sutures. They dissolve, but they hang out for a while, usually about 3 to 4 months. And these deeper sutures are broken down by your body and replaced with scar tissue. And that scar tissue functionally becomes your new ligament. So instead of having these intermittently placed fibrous attachments holding up your facial structure, you now have these specifically planned new functional ligaments out near where your incision lines are that now is keeping everything in place. This is good on 2 levels. One, these are much stronger than your anatomic ligaments. They're much more regular and they keep everything suspended in a much more predictable way, which is going to fight against aging. Number 2, these ligaments are carefully placed in an area where they are not causing any tissue obstruction, meaning as you age after a deep plane facelift, you're not going to form those typical lines of aging in the same way that you would have if you still had those ligaments intact. So that's part of the beauty of the deep plane, and that's part of the reason why there's so much more longevity in this type of facelift, because truthfully, after a deep plane, you're always going to be better than if you never had anything done. Yes, you're going to continue to age, gravity happens, tissue sags, but you're not going back to that point where we've had these tethered areas creating these deep lines and folds. Hopefully that helped clear up some confusion. If you have any other topics you'd like to hear me cover on one of these beach walks, please leave them in the comments below, and otherwise have a good day.